I want to give you one tip this year to think about for your medical plan renewal. If you're an HR director, CFO, business owner, could be one of the best tips you're going to hear all year. Okay, you ready? One thing. This year is the year to simplify. Reduce the complexity. Make things easier. Look, we've been through so much stuff, crap, call it what you want with this pandemic, that people want simplicity. And what I want you to do is, if you have a whole bunch of medical plan offerings, I want you to try to reduce them. Now, I know when I say that, people are like, oh, that's the worst idea, John. You want more choice. We want employees to have lots of choices. And I'll tell you what happens. First, you have one plan or two. You have a base and a buy-up. Okay, great. And then along the way, you're like, hey, we need maybe a little less expensive plan. So we put 3 plans in. Now we got 3 plans running. And then a little along the way, you're like, hey, we need an HSA plan. So now you have 4 plans that go along the way a couple years. And hey, we need a really cheap HSA plan. Now you have 5 plans, or 4, or 3. And I'm telling you, your employees are confused. You may think it's the best thing to have choices. It's like a menu when you walk into McDonald's or Burger King or Starbucks. It's not. People don't understand health insurance. 80% of your employees can't define what coinsurance means. So how the heck are they going to pick a plan when there's this grid of numbers and definitions that they don't get? Now, I know my HR friends, you guys are doing a great job. You understand this, but you may have 60 employees or 30 employees or 20 employees. They hear it one time from you, maybe. They don't understand, so you want to keep things simple. So here's my suggestion. Reduce the number of plans. I know some of you are like, that's crazy, but this is what you have to do. You have to do it in conjunction with something else. Reduce the number of plans and backfill it with first dollar coverage. There is an ebook down in the description, a free book, no strings. Just click it, download it, and read it. It's very simple. It explains how you can have a 0 deductible. You can eliminate the deductible if you want on your medical plan. So what are you doing? You're going from 3 or 4 plans, let's say 4 plans, and you have a real low deductible, a little higher deductible, a little higher deductible, then a $6,000 HSA. The plan design that we look at will take you from 4 maybe to 2. And then we're going to provide a lot of first dollar coverage so that someone else will pay the bill when you go to use your insurance. Someone else is paying the out-of-pocket expense first. Would you rather pay it or have someone else pay it? Like, real simply, if I go and break my leg and I go into the emergency room, either I'm going to pay for that first dollar coverage, that first expense, or I'm going to have someone else pay it. And that's what we do. We find companies that will gladly pay that for you. Now, there's some trick to this. There's some strategy. There's some complexity on our end, but you don't have to worry about that. That's why you have an advisor. Look, there are 8 to 10 different companies that we can use in 30 different product categories. So there's all this complexity on our end, but you don't have to worry about that. That's our specialty. It's like when you go get your knee replaced. You don't have to worry about how the surgeon does it. They just know how to do it. They know how to fit it. That's what we do. So grab the ebook below, understand how you can reduce the complexity, understand how you can put a 0 deductible environment in, and also you might even be able to save money along the way. I hope this is helpful. Thanks for listening. We'll chat soon.